Well, hello. My name is Gary Lucas, and I'll be presenting the Rural and Community Health Documentation, Coding, and Billing online self-study class. What I'd like to do with this course information and navigation module is briefly introduce you to the unique approach that we've created here at the Association for Rural and Community Health Professional Coding, designed to give clinical providers, facility managers, and coders and billers access to the important information they need to maintain compliance and maintain optimal revenue viability because you're the ones serving America's uninsured, underinsured, and most importantly, those people who don't have the traditional access to the same medical offices that other folks do have. I'll be your guide through this journey, not only for the navigation module, but through the 5 main sections of class that we'll outline here. But there are a couple things that we need to go over in order to make sure you maximize your learning experience. One of the things you may already notice that's a little bit different is we'll be moving and showing you 2 sides of the screen. One will be a video with me. The other will show you what I'm looking at on my screen. You're going to see me occasionally look down to advance the slides or make some highlights on some of these slides. I'm really going to be doing the same thing that I hope you're doing when you're studying. So we'll not only help make sure that you have the materials that you need to maximize your learning, but also that you've organized your desk space in a similar way that I have so that you have your books, your materials, not only these slides, but that you're constantly accessing the internet and making bookmarks on key sites and saving key documents in order to build a binder that you can use for self-study. You have my email address down here. Please let me know if you have any questions following this module before taking the exam for certification to become a rural or community health coding and billing specialist, or if any of the technical content has changed or maybe been updated since we recorded this. The section breakdown will allow you to first get a vision of what the overall course looks like, and especially for those of you that have been in the traditional medical office or traditional outpatient hospital or inpatient hospital world, there are some very unique aspects to rural health clinics and federally qualified health centers, also known as community health centers in this course, that we really need to break down that are extremely unique. And even the most established veteran in this industry has some new things to look at and unique issues to learn. And we're going to take a lot of time to break down the issues in this first section for clinical providers, managers, and coders and billers alike, because we recognize the vital importance of working together to establish good workflow processes and really to update and change the way we're moving information from the provider's mind to the medical record, then from the medical record to our internal business forms like a super bill or encounter form. And then how does the coder and biller manage that information to adjust that bill to meet the unique standards put forth by maybe a Medicare or Medicaid carrier, which may be completely different than how a commercial insurance company might want it. So we're going to try to bring everybody together in this first section and outline some of the unique issues you need to be aware of, and most importantly, get you to grab a hold of a lot of valuable materials that you're going to need in order for your studying to be most effective. And that goes anywhere from your coding manuals to some Medicare documents and a lot of good things online that might be too large to print, but certainly can be held in a nice bookmarks folder. So if you look over the next 3 sections, you'll see the 3 main groups that we're going to be presenting to. And each of these groups has a unique focus we'll be focusing on. First, as everything really focuses on the clinical documentation, we welcome any clinical providers to this section. We realize that you didn't go into practice to treat codes. You went into practice to treat patients. However, there are some important documentation requirements that must be followed in order for the patients to have access to all of the health care they received, also to help with optimal coordination of care issues between you and your fellow providers, The documentation requirements can assist your facility in not only generating the revenue that's important in order to keep your doors open and be able to grow, but it's also going to assist in meeting some of those compliance requirements with the new world that we're entering into in terms of pay for performance and quality. And we'll try and tie all that together in that second section. Now, if you're a manager and a coder and biller, of course, please don't skip that section because optimally, we hope that somebody that represents each of these three areas is going to take this course and learn together. Because there's a practice test that's included in this course, because there's an optional certification exam, each person is going to need to maintain their own username and their own unique password. But if you're a manager and a coder and biller, please take notes in this second section that you believe you'd like to pass on to your providers who may not be accessing these online self-study videos. In that section, we'll break down the difference between CPT guidelines and Medicare guidelines and a lot of interesting things, hopefully that will allow you to keep your focus on the patient, but help meet the financial and business needs that we have because we do bill insurance. Next, Section 3 is going to present professional coding for management. Now, interestingly enough, we have not traditionally had a lot of facility managers or department managers attend these courses because they've said, well, I hired a certified coder, or we have some IT systems that are going to help us achieve some of the goals that each group needs. Many of you may have already undergone some of those IT changes and implemented different EHRs and billing systems and various management systems and patient scheduling modules and chronic care modules and a lot of different things. And the managers have probably found out, if not already, that sometimes those systems don't talk well to each other. And in order to optimally manage the clinical providers, and optimally manage those coders and billers and nurse managers and EHR professionals and other folks, we want to make sure the managers develop a shared foundation of knowledge that allows them to really be a good bridge between clinical providers and the coders and billers. And honestly, having the opportunity to spend literally half of my life providing courses like this on documentation and coding and billing, I'm really seeing more managers who are walking out of these courses that will never code a claim, that will never document in a medical record, but now have a shared language that allows them to communicate between those two areas and, most importantly, create policies and update processes to meet the realities of what our facilities are really facing today. And so we're going to put managers as being primarily responsible for coding, even though we know that many of those responsibilities are the primary focus of the provider when it comes to documentation, or the primary responsibility of the biller, or could even be an external billing company. But the managers are the ones that are going to be responsible for the bottom line and any issues that come up. And so we hope to help empower you managers in this field. Certification is still an option for you, but not required. The next section, proper billing and reporting for coders and billers. And this is obviously going to be the central core focus of what we're doing. And honestly, you can really take a variety of subjects and really talk about it in each of the three areas. We're talking about preventive medicine being a big focus of what you do. Well, there are documentation rules, there are coding rules, and there are unique billing rules that also apply. But as we go through this first section, the introduction to rural health and FQHCs will kind of develop a shared path for everybody so that you can put yourself on that path and understand what we're going to talk about and when we're going to talk about it. Now, last but not least, that last item, a review of action items and how to get results. I've spent a lot of time, as well as my colleagues. I've trained physically in 46 different states over the last 24 years. And we can teach all day long, but helping you go back and get access to the results that you need would be most important, to give you action items to achieve, to show you how to get the positive results you're looking for is going to be a focus of ours actually at the end of each of these sections. In Section 5, we'll review those action items, summarize our most important points, give you some action items to get the results you're looking for, and we think that will, in addition to the optional opportunity to become certified after taking this class, to be able to take back results that benefit your patients, your practice, and assist your organization in feeding the public health system with really good knowledge to recognize the increased complexity of care that you might have of some patients that don't have traditional access to other medical offices. And so we'll do that through some exercises in each section. You'll be very active with your pause button. After class, if you need to get back in touch with me, here's my contact information. Email is always best, but of course, if you need to reach me or any of my colleagues that I'm about to introduce you to here in a moment, that phone number will get all of us. We've recently made the move to a new website, Arch Pro Coding, Arch standing for the Association for Rural and Community Health Professional Coding. But in the meantime, both sites should and will be active, and I welcome you on this educational journey. Here are my primary cohorts. These are the core folks with our association many of you may have met. In case you hear me mention their name or anything during the course of this presentation and the further sections, John Beard is the CEO and founder of the organization. He started this 8-9 years ago because he recognized there's a gap in the education and certification for those of you that work in America's underserved areas. Julia Scott. Each of these folks has been a friend close to 20 years. Each of them, we've worked with each other in various capacities and in different companies. Julia is our member services director, and she can assist with all membership issues. We'll talk about the Member Center, that is one website of ours. We'll talk about the e-learning center and testing center that you're on now. And if there's questions on continuing education, memberships, or anything else, Julia is definitely going to be able to help you out. I need to take a quick moment to thank John Burns in particular, mostly for his just friendship and professional collaborations. Over the last 21 years, he and I have been shoulder to shoulder teaching similar information. You may meet John or I, John Burns that is, out and about when we bring this course to your state. We travel the country and have done so for a while, working with your state rural health associations and your state primary care associations, bringing this class to you in person. And both John and I look forward to the opportunity to meet you in person and teach this class. Heck, maybe even after one of you in your office takes this course, the same content will be presented live that you're getting via this online version. And having taught about 1,600 to 1,700 different face-to-face workshops over the last several decades, I think that face-to-face training is always going to be the most optimal learning scenario because you have the chance to be face-to-face and ask questions and carry on a conversation. But I hope to keep this online version equally as engaging, and we hope that the side-by-side approach that you have with the video on one side and seeing the screen on the other is going to be more beneficial than just the same old kind of boring webinars that we've all heard over the years, where you might see a little webcam and you might hear a voice over a speaker. But in this case, we'll be able to make the same highlights on my screen that I'm hoping you make on yours to keep it engaging. Now, of course, there are a lot of disclaimers. We have quite a few organizations that write a lot of big, thick material like this ICD-10, like the American Medical Association, in terms of the CPT, and Medicare, of course. And so we just urge you to recognize that the content that we describe, whether it comes from the American Medical Association CPT, whether it comes from a particular publisher's ICD-10 or HCPCS book, or it's maybe just a Medicare carrier's website that has some good information, that you always check for updates, and that all of the material that we're presenting is known to be correct at the time we're filming. But heck, I could just hear there in the background, even though we have everything down right now, they might have just changed something 10 minutes ago, and we'll all get that updated via email. So please do use these slides to pass on to others inside your organization. Please do not pass it on to others outside of your practice, especially since it may have changed. And also, we want to make sure that we keep this content for only those of you who've paid for it and who are going through this educational journey, so that you can hopefully get certification and improve your career and learn more to earn more. We are not responsible for billing or legal advice, and I know that sounds a little bit odd, but I'm going to say something that might be unexpected, and that is, don't believe anything I say over the next 5 sections until you verified it for yourself. One of the real big issues we'll get into here in the first few sections is how there are very different answers to questions that you may ask based upon is somebody asking a how do I document that service question compared to how do I code for that service in my code books compared to how do I bill for that service. Heck, if you're asking a billing question, sometimes the answer is going to be different if it's a Medicare question, a Medicaid question, and there could be a variety of approaches that commercial insurances take. So we really want you to be very cautious and careful and recognize that it tends to be the entity whose tax ID number goes on the claim form that would be responsible for any compliance issues. I mean, honestly, folks, our goal is to get every dollar you're entitled to, but not more than you're allowed. To achieve that nice balance, to give everybody in your organization the ability to contribute positively towards achieving compliance goals and profitability goals. But please, as it says down here, always verify all reference materials before, and anytime I say a CPT code, note that that is owned by the American Medical Association. And we'll make some recommendations on, which manuals we think you need to hold on to, and quite honestly, how certain IT and software tools, often known as encoders, may not have the same information that a physical book has. So as we continue here, I want to make sure that if you have not already done so, that before you entered this room that you located the resources button. If not, go ahead and pause this, close the video window, go back out to where you launched the course, and select the resources button after making sure you've accepted the terms and conditions, of course, which you did in order to get here. But oftentimes in each section, we will provide you with the links or actual documents that you'll see me reference in each of the video sections. You're going to have 20 or 25 different windows open by the end of this full course. But in many cases, we'll already present you with some materials you need to build your 3-ring binder that contains a lot of these printouts. And so I have my workspace here organized very similar to how I'm going to ask you to organize yours. But if you'll do me a favor, make sure that you have access to the key materials to include the class slides before beginning section 1. So the possible sections that you can have for your self-study binder would be, of course, the main course slides, which will likely drop into each of the 5 different sections. And at the end, we may be able to give you access to one master copy. But depending upon how you organize your binder, you may want to separate each of the 5 sections into what resources are important based on documentation, based on coding, and based on billing. But in addition to that, there's going to be some self-study materials, as you see on your slides there, and many documents. And even, heck, a blank page full of acronyms or glossary terms that you maybe hear me mention and need to go research. If you had to pause the video to go look up an abbreviation that I maybe forget to give you, or an organization that I mentioned you're not familiar with, please go ahead and make a specific note page for just that. Also, We think there should be one page, possibly near the beginning of that, if you, regardless, I should say, of which group you find yourself in, you know there are going to be notes for those other folks that you want to take with them. And heck, you can blame us. Instead of saying, here's what I think you need to do, you can say, here's what these folks at the Association for Rural and Community Health suggest that we do. And many of you may note that I might say the exact same thing that you've said to a colleague for 10 years. But for some reason, when it comes from somebody from out of town, let alone on a video that's on the internet, it must be true. So keep those in one area, because it's going to be difficult to find and locate those notes in a centralized location after hearing the many hours of this online self-study course. So if you could put those at the very beginning, you're going to hear me mention those quite often to assist the other groups, or identify some things that are very related to what we do, but might be a little bit outside of our scope. And so we'll identify some of those areas that are outside of our scope, but important to be aware of, and keeping these in a central location is going to help. Some of the documents that we're going to reference for you are just simply too long or likely too large to print, or we only need access to a couple sections of it. For example, we get to Chapter 18 of the Medicare Preventive Service Code section. It's 249 pages of material that you really just want to create a bookmark for. So go ahead and create a folder, if you have not already, that is going to identify your bookmarks. Of course, CMS you see on the screen is going to be one you have to have. Access to our website, the Arch Pro Coding, is going to be a good one. Whether it's HRSA or the National Rural Health Association or National Association of Community Health Care, or Health Centers, or National Association of Rural Health Clinics. A lot of these folks are out there, in addition to us, trying to provide that kind of support, and we'll do our best to make sure you get access to each of those sites, and heck, maybe even get on their automatic email lists to get those updates as they pass through. As we mentioned earlier, go ahead on your desktop and please call this your Arch Pro Coding. Remember, Arch is Association for Rural and Community Health. Arch Pro Coding self-study documents, and make sure that you use the little Control F feature for find, because sometimes you might open up that 250-page document for preventive services, and you only want to find information for your annual wellness visit. Well, you'd want to hit Control F, put in annual wellness visits in the Find feature, and it'll take you right to where you need to go. A lot easier than scrolling through some of these large documents. So you should have at this point, as we'll talk about in the first section, your CPT. I am a big proponent of the American Medical Association's Professional Edition, and even their digital app, which I'll talk about a little while later here. But their digital app is going to give you access to a lot of really interesting things you really didn't have access to before. But I'll describe later why we strongly believe that an AMA CPT is far superior to other publishers. In particular, and your little hint, is that it's the only place that these guidelines are written. So I'm going to turn to a random page here, but whether we're talking about preventive medicine services, all of the information contained in these paragraphs are only found in an AMA version. Now, it doesn't matter which version of the HCPCS Level 2 codebook or the ICD-10 codebook that you have, because the information tends to be relatively stable, and those books are not too full of documentation guidelines. But if you do not have an AMA CPT throughout this course, you will have difficulty locating the answers to some of the exercises that we're going to provide to you for practice. Most importantly, you may not have access to the documentation guidelines needed by your providers, your managers, and your coders and billers to maintain compliance and achieve profitability. It should be noted that when we get into this section, that I think I've heard it said one way by somebody, that coding is coding is coding is coding. Professional coding doesn't change too much based on whether you're a rural health clinic, or a community health center. or an FQHC. The CPT and ICD-10 CM book and the HCPCS Level 2 code book do not often, sometimes they do, but they do not often describe different documentation and coding rules based on what facility you're in. It's the billing rules that get very different. We'll talk about it in section 1, but of course, rural health clinics that have been designated by Health and Human Services as a rural health clinic get paid under a system called an all-inclusive rate. Federally qualified health centers, that will say community health centers and use those two terms interchangeably, but community health centers and FQHCs get paid by Medicare mostly under what's called a prospective payment system. Completely different billing rules, different patient coinsurance rules, different deductible rules, and heck, you might do the same service in either office and have to bill for it completely different. Now, the coding for those may be the same. The billing may be different. Welcome to the wonderful world of rural health clinics and community health centers. We'll break that down as we move forward. But not only should you be very cautious of which examples I give in that, an exercise, but definitely on your certification exam. So your final goal here may be, and I'm going to kind of assume that your final goal is to take and pass our optional 100-question online certification exam. And as I finish this section up, notice that that will be a theme that I bring up throughout all the sections here for you folks. The optional exam and the practice test are items I'll talk about at the very end of the last section, and how to go ahead and get ready to take those exams and hopefully pass that certification exam. Make yourself more marketable. Show yourself as a high-level professional regardless of which area you're in, especially those in coding and billing. We hope that this course shows that coding and billing in these facilities takes high-level critical analysis skills, the ability to work very closely with providers and managers, and these themes will tie together as we move forward and finish this course navigation and information module. So as you're going through each of the sections, notice that each video section is separate, and that if the system notices you haven't completed one, it may not unlock the second video. So please make sure you let each video run all the way to the very end, or the next section may not unlock properly. Of course, go back to the different launch page to go to the next section. And once you complete them, we'll talk a little later about how the exam will be unlocked. So the pause button is going to be your best friend. Please use it very wisely and very often. When we give you little pop quizzes tucked in each section, what I'm going to do is read to you the question, share with you where the resources are located, and then ask you to pause it. Go study, go find what answer you believe is correct, unpause it, and we will then provide you the answer and some discussion points. So it's a very, very interactive course. This is definitely not a push play, sit back and just listen. We want you to be engaged. You're going to see me looking at my computer so that I can circle notes that we're asking you to make. You're going to see me grabbing materials often on my table the same way we're asking you to do yours. So here's how your your desk should be organized. Your books in one area, the self-study materials on another side possibly, and your videos here in the middle. So be ready to read your code books. Be ready to grab those manuals. I think you'll notice that if you use IT or software rather than the manuals, you will not locate many of the things we're looking at. But highlight, make a lot of notes, and we really hope that this educational journey is one you're going to find value in, and that you know that you have support as a rural health clinic and support as a community health center when it comes to documentation, coding, and billing. And we look forward to being able to help you on that journey. So let us know what we can do to help. Go take that exam and let us know what we can do to help you learn more to earn more. Thank you.